Well, good afternoon, everybody. Welcome to Shadow Hills High School Knights Parent University. It is September 22nd, 2021. I am Principal Fajardo, and I'm joined today by two of my assistant principals, both Mr. Wells, our assistant principal over student support services and special education, and of course, Dr. Kalkowski, our principal that oversees our attendance, curriculum instruction, and assessment. So today's topic of discussion, parents, and thank you for submitting some ideas, centers around our health and safety. With that, I'm going to have Dr. K kind of open us up, give you a little bit of information about what we've been doing with respect to some of the safety measures surrounding COVID-19, the pandemic, and then I'll get into a little bit about some of the notifications that you're receiving, some of the data that's been put out there, because you've received some notifications from us about close contacts, the general exposure letter. And then we'll end it with Mr. Wells, who will go over a lot of information relating to some of the counseling supports, our request for some support and assistance, and he'll end it with that information. That said, Dr. Kalkowski, please.
Thank you, Mr. Fajardo. And parents, I just want to say how wonderful it is, amazing, incredible to see your students every day. Things are going very, very well. I'm absolutely shocked they keep their masks on outside all the time. It's wonderful, and certainly in the classroom. So very, very pleased. So I want to just go over with you the Shadow Hills High School daily cleaning checklist. There's a lot of cleaning going on, and we see our knight here saying all of our knights mask up. On the daily, cleaning high-touch areas, daily and nightly, and even between classes. Sometimes I see teachers and they'll be taking wipes, and or those are available to students to be able to wipe down a desk as well when they come in the classroom. We have additional custodial staff who assist with our cleaning. We are engaging in a touch-free disinfectant sprayer, so that there is no chemical touching to the skin, cleaning and sanitizing materials being used as well with gloves. We use disinfectant cleaners, and all of the staff goes through, and even us as well, the Keenan Safe Schools training requirement. And that's something that everybody, staff, teachers, can always access and review anytime there's some sort of change in the procedure. For right now, everything is up to date and everybody is trained on the Keenan Safe School disinfectant procedure. We use pressure washers, outdoor lunch areas, playground equipment, all of the things that are touched, even the rails that the students lean against, and things that when they go up and down the stairs, those are also disinfected and wiped down. We use a disinfectant spraying equipment for large assembly areas. We don't have a lot of gatherings, but where the students are out at lunch, then we will follow up and you'll see the custodians. They're outside disinfecting. Our outdoor tables are rinsed down with Super 60. Again, some training of which they had to go through, and an equivalent disinfectant that's following our meals when there are no students around to sit at the table. So all of that is done sans the students, they're not there. So to kind of sum it up too, and this is important because we've been consuming a lot of water, and the students know the two spots to get the cold water, but that is the drinking fountains. All outdoor drinking water fountains are open and available for use, and students are encouraged, and they're doing this. And I see the most awesome personal refillable water bottles and great stickers that they're putting on there. And so thank you for providing those for your children because they're kind of expensive. Yeah, right? Thank you, Mr. Wells. All classroom sink faucets and water bottle stations are open again and available for use. Our classroom and common area sanitation setup. Classrooms without sinks have wall-mounted sanitizer dispensers. So literally, and I see this because we go into classrooms all the time, and the students are so good at it, it's automatic. I don't know if you have them set up at home, parents, but they just walk right in, they press the little button, and they're getting sanitizer when they go in, and I see the students gently and calmly waiting for each other, and they do it as they go out. It's really extraordinary. I love high school. The portable hand washing stations are available outdoors at the school sites to supplement healthy hygiene practices, and we have those at our gate, our stadium gate right out there that we use for athletics. And I go past there every day when I take courts out, and they're right there for the kids who are in PE. So they use those as well. Teachers review the healthy hygiene practices daily with the students. I can attest to the fact that they're taking longer in the restrooms. They're doing that whole ABC thing because they're really coming back with washed hands. It's taking a little longer. Everybody's aware of that. And all the bathrooms are equipped with soap, paper towels and hand dryers, and refuse containers. Okay, here are some of our COVID-19 indicators. You can always access the Riverside University Health System for some of the most current data. They have public health. We have a Riverside County indicators. They're updated Monday through Friday. That provides a map and a geographic data location with reports that are updated Mondays. And these are the cases and case numbers. There's also a variant dashboard, of which don't ask me to discuss the statistics. I did write a dissertation, but it's kind of out of my brain right now. But that's the variant dashboard. It does talk about the statistical proponent of students and people in the Riverside County are affected with COVID.
And Dr. K, the purpose behind sharing this information, parents, is we want to equip you with where to find these resources, in which case we're always keeping our eye on it as well, because we're doing our part to try to mitigate the transmission of COVID-19, and just wanted to share this information with you. And of course, as Dr. K mentioned, you're able to search Riverside University Health System, Google the COVID-19, and you'll receive this information on their landing page. Yeah. So it's there for your reference, mostly, right?
Yeah. Yeah, very good. And, so on a site and on a daily, here's what, and this is kind of something, actually, honestly, parents, you could put this on your refrigerator. Screening all students for potential COVID-19 symptoms. We as staff have to come in and we answer when we turn on our computer, do we meet this certain criteria? If you have any of these, then here's what you do. So we have our low risk general symptoms and then our high risk red flag symptoms. And so you can take a look at that. They've got the little emojis, which are interesting. I don't think all of those emojis are on my phone, but certainly those are the indicators. If there's a cough, difficulty breathing, and then the number one, loss of taste and smell. And that's really, really significant because allergies are out there. They're doing the scalping right now. I take that little Claritin every day, but I don't have any of that loss of taste of smell. So those things you have to really examine what's going on with that. And then certainly our DSUSD puts together the COVID-19 safety plan, and it has many, many pages. And this is just one of those graphics that you can see within that larger document. Likewise, here's an exposure. So this is kind of like a flow chart. And the truth is, parents, and I know these can be very confusing, the more you look at it and you kind of break it down, and certainly as you go over it with your child, then it becomes more familiar. Okay, so you ask yourself, what is the exposure that I've had to this COVID-19 positive person? Well, a close contact, is it less than 6 feet, 15 minutes or longer in a 24-hour period? So that's something to ask. If it's a low-risk symptom, you stop, right? Or send home, return to school 24 hours after the symptom resolution without fever-reducing medication. And that's kind of really important because sometimes people want to address that fever, right? I have a 25-year-old who's still a fever kid. But if you really want to see if they're well, you've got to get them off that medicine, even though it's uncomfortable to see if they're still having the fever. And the rest of that. So I'm not going to kind of break it down for you, but it's more of a quiet, you look at it, study, is less than 2 low risk symptoms, or is it 1 high risk symptom? And then so on and so forth. Likewise, here's the one, and this is your daily checklist. And again, this particular document, page 15, page 16 are your friends in the COVID-19 safety plan through the Desert Sands Unified School District. And when you go right on their webpage, you'll see it first thing, and you can click it, and it comes up, recommendations for students. And I've already had parents ask me, so I have this on my desktop. If you ever need to, parents, and just say, can you send me that one document flowchart, Dr. K? I've got it right here for you. But these are the things that you say to yourself. If a student is exposed to a confirmed positive COVID-19 case by being in a close contact, so then you'd have to go back. What does that mean? 6 feet, 15 minutes, 24 hours, that sort of thing, which is defined. Here it is. Then you follow the steps below to determine if they need to quarantine at home or if they can attend school. Because the truth of the matter is, it's around. But your kids are all masking. And so that's fantastic and that's significant. And we don't want them to miss school. I know you're thinking, well, I want to err on the side of caution and make sure and so on. Well, let's look at the chart. That's the most important thing. Is the student symptomatic? If no, right? And here's the caveat, right? If they are fully vaccinated or if they have tested positive for COVID-19 in the past 90 days, right? Then take a look at the next two. If yes, they do not need to quarantine. Students can go to school. If no, where were they exposed? And then you go down to the next one. Was it at home, in the community, right? And that's where we start to diagnose and determine and distill where these outbreaks and things occur. Quarantine may return between 10 to 20 days of quarantine if there are no symptoms, and that depends on if the infected person can completely isolate. So there's that within the home as well. Okay, so then you take another look. If it was at school, were both students wearing masks? And as I shared with you earlier, it's extraordinary to me. And, I go home with, I call it maskne. I mean, it's tough. We're wearing our masks all day. I feel like a 13-year-old adolescent here. But the truth is they're all wearing the masks, and it's wonderful. So if as it was at school, if they're both wearing their masks, if yes, maybe a modified quarantine while attending school. Students must remain symptom-free. You can take a PCR or an antigen testing. Should be done immediately upon notification, and a PCR after day 5 of exposure. You can get those over at CVS, and they're behind the counter. I learned that. You can't just find them on the shelves. Modified quarantine can end after day 7 if the PCR test is completed after day 5. So you kind of got to look at the dates of the last exposure and if it's negative. And then there's no and within that, and this is where it gets sad because the kids are like, well, I still want to go practice. No extracurricular activities at school, including sports, during a modified quarantine for 10 days. Or if parents choose not to test their child, they may quarantine at home and return to school on day 11 from exposure. There is choice there. We're not forcing anybody. But we can see here, if you go back up to the middle, no, if no, where were they exposed? We talked about as a community, school. If no, quarantine at home for 10 days. So I'm looking at the lower right green box there. Or quarantine at home for 7 days. Okay, and again, you got to kind of get your days with a negative PCR result. The test must be taken 6 or after from that day of exposure. After the test, the student must stay home until a negative result is confirmed by a school nurse. If confirmed negative and there are no symptoms, the student can return to school on day 8, where they can finish a modified quarantine at school for the remainder of the 10 days. So it's very, it's a lot. And I hope I covered it all, the nuances of it. But again, the most important thing is that you kind of look at this carefully. You know your dates. And parents, I want to just share this before Mr. Fajardo goes into this slide. The learning doesn't stop. Hopefully and certainly your child does not get ill. But the truth of the matter is the learning does not stop. We keep going. They please reach out to their teachers, Google Classroom, email me, call. We're all here for you. I'll serve as a conduit to the teacher and say if he's not feeling well, that he has to have extra time and so on and so forth. We've got you.
Thanks, Dr. K. And speaking of all this, parents, as a parent myself, I've got, 2 of my children here. You can imagine, the concerns that a lot of our families have, including yours, when it comes to some of the notifications that we receive via school messenger, right? And sometimes you folks thinking, well, there's a lot of information being shared, in which case I wanted to go over some of the general notifications that we do send out. The primary one that we do send out to families is whenever we are in the process and have confirmed a positive case of exposure to a positive individual with COVID-19, a letter is sent out to our families, right? And this is any person on campus. And while we don't identify who that person is because of privacy policies in place, we do send out a general notification. And this is an example of that general notification. In fact, I think one is going out today for this very reason, in which case the letter does stipulate information on there for you to read. And please do read through the entire letter, parents, because it will answer a lot of the questions that you have. And I fielded some questions as it relates to this particular letter or this notification. But the one question that always comes up is, Mr. Fajardo, does this mean if I receive this general notification that my student has to stay home? The short answer is no. You will receive a separate letter if your student is deemed a close contact. As Dr. Kalkowski alluded to earlier, a close contact is defined by a person who's been around somebody with a positive case of COVID-19 for more than 15 minutes or more and within the 6 feet of distancing. In which case then there is a second letter that will go out, and I'm going to show you what that letter looks like. And this is, well, first, a letter that is actually sent out as a notification letter, rather, to a family or a student who may have been exposed outside of the school, okay? So the general notification, the first one I just showed you before this one, was if it's an exposure on the inside of the campus, and then there's a separate notification that is that obviously does read a little differently when the student has an outside COVID-19 exposure. So that's a separate notification. Now, the one that I wanted to get to, and that's page 2, by the way, of the student outside exposure letter, is a letter that goes out to not only students, but also to staff, because a question came up, and forgive me for these being a little bit out of order. I thought I put them in order, but as you can imagine, sometimes getting them in order like this is quite difficult, although I think each of them has and merits their own explanation. In which case, this one here, which is labeled AB 685, stands for Assembly Bill 685. It's actually a state requirement that we must send a notification to all staff for notification of a potential COVID-19 exposure. This one is important because our teachers receive it, our counselors, all staff, faculty members included, do receive this notification whenever there is a general exposure that is, that does take place with us here on campus. Now, the one I'm getting to that I wanted to determine as a close contact, it depends on whether or not your student is vaccinated or if they're unvaccinated, in which case the school nurses will call you to contact trace to deem whether or not your student, in your case, your family member, will receive either notification. And this is the close contact notification, in which case this particular letter will go out to a student after they are deemed vaccinated by way of the school nurse. Your family, will receive this letter that does determine that your student was a close contact, and it explains what you need to do procedurally for said student. Now, if the student was unvaccinated during the time of exposure, and they may have had their mask on, in most cases, this is where we find it happening, is in the classroom, when you are determined to be a close contact and you do have your mask on, because that is a requirement when you're indoors, you will receive this particular notification. For a student who may be unvaccinated and obviously was wearing a mask during the time of exposure, okay? So again, different types of notifications do go out, but unless your student is deemed a close contact and all you are receiving as a general notification letter, please do send your child to school. Because if they are determined to be a close contact, or unless yourself are reporting it to the school that your son or daughter was a close contact outside of school, then of course, as Dr. K mentioned, we go through that proper protocol as illustrated in that tree, that decision-making tree, in terms of what we need to do at that time. So hopefully this does provide you with a little bit better of an explanation as to what these letters determine. And some of these letters are 2 pages, like this one, in which case, please do read through the letter, because it's very important that you have all the information that's made available to you. And as I mentioned, in some of the letters that I do sign, some of the letters may be signed by our Assistant Superintendent, Mrs. Laura Fisher. Please feel free to reach out, folks. You know our number, 760-393-5400. Any one of us are available to answer any questions you may have as it relates to some of these notifications, okay? And that said, speaking of notifications, also the district does have their COVID-19 dashboard. It's updated every 14 days with information, because again, it does go through the cycle of quarantine, if you will. So these are the staff and student cases. I dropped this particular screen grab as of earlier this morning, so you can see that the total active cases district-wide are 8. In our case, for Shadow Hills High School, we have 7 students and 1 staff active case as of this particular cycle. And again, that information is made available on the district website for your reference as well. And you can easily find that on www.dsusd.us. You'll see one of the graphics there for COVID-19, the safety plan, and it'll take you to a link for the COVID-19 dashboard. Now, I'll go through this, Dr. K, if you want me to, some important reminders. Speaking about what Dr. K mentioned earlier, folks, we do encourage testing. Obviously, that for us is very important because it does mitigate the transmission of COVID-19. And it's just not about our school, it's about our community at large. We want to make sure that our hospitals have the available beds necessary to ensure that they are providing the services they need to provide. So we need to do our part to ensure that our students are made available, information and opportunities to test, including our staff. So what we've done as a district is we've partnered with Living Fit Nation. And Living Fit Nation provides PCR testing for our students and staff. And in our case, for Shadow Hills High School, we do have testing available Tuesdays from 3:30 to 5:30. We made a change in location to our lecture hall instead of the multi-purpose room. So on Tuesdays from 3:30 to 5:30, and it's free of charge, you're able to come through the back parking lot, access the lecture hall where Living Fit Nation is set up Tuesdays from 3:30 to 5:30 to ensure that we do provide you with testing. Now, for students that are interested in testing, there is a link in my dispatch families. You can go onto the dispatch, and if you need access to this information, you can call the school. But I'm going to open up this link because this is what students do receive, and I'll zoom this in families. You'll receive this information in a PDF document, or you can screen grab the QR code that's on the actual dispatch itself, and then you click here to register your student. And if you're interested in registering your student for testing, you simply fill out this online registration form, and all this information is privately secured through our vendor, Living Fit Nation, and it's confidential in nature. But at the most part, once you fill this out, then your student is able to go through the testing procedures with us on a weekly basis. And so obviously this does expand our safety efforts that we have put into place to mitigate, as I mentioned, the transmission of COVID-19. We want to make sure that everyone has an opportunity to get tested. So if this makes it convenient for you, we do encourage you to please sign up and take advantage of this opportunity through Living Fit Nation. Now, if your student is a student athlete, we do have the voluntary testing that takes place also on Mondays for student athletes. That is also conducted through Living Fit Nation. And if you're asking, well, what's a PCR test? It's the little nasal doohickey that goes up your nose, unfortunately. And yes, it's a little uncomfortable, but a lot of our students who have gone through this, our staff included, you kind of get used to it. So that's a little bit about that, and just wanted to provide you with some reminders, families, on that information. So at this point, it's a nice transition to Mr. Wells.
Hi, good afternoon. Thank you for joining us this evening. I'd like to share our contact information for our counseling staff. I'm honored to work with this group of people. They are so dedicated. They're working really hard to make sure that your students get what they need. They're basically your one-stop shop. If you notice on here, they all have a caseload that's divided up by last name. So, for example, Mrs. Morden has the last names that begin with DIM through Lopez. If you're not sure, our website has a link to the very top to a menu for counselors. All this information is there, or call the school and we'll get you in touch with the right person. Next slide, please. Some of you may ask, well, what are the duties that a counselor has? Well, first off, their job is to really provide opportunities for your student. And we encourage all students to reach for the very top. And for us, that is making sure that they're eligible to go to a four-year school, a four-year college out of high school, because we know that if they reach that level, they can do anything else. They have very many options. So what our counselors do is they monitor course requests each spring, and then they meet with the students to talk about how does this support your long-term plans. And again, we always recommend the most rigorous course load, because we know that that opens doors. But in addition to that, apart from the academic side, our counselors really encourage all of our students to get involved with school, whether that is through clubs and activities or extracurricular pieces like performing arts and athletics, because we know that students who are engaged in school come to school more often, their grades are higher, and it reduces anxiety. They have that connection to their school. They want to be here. This is a safe place for all of our students. We are dealing with an unprecedented time where many people are fearful. They have high anxiety. As a result of that, what we've had to do is really look at ways that we can support our students differently. counselors don't do therapeutic counseling. They do what's called solutions-based counseling. And basically, it's making sure that students have tools to try to find solutions for what's blocking them from doing their academics. However, we recognize that there are students, because of their needs, who may need a little bit more. So as a result of that, we have begun to do some small groups that are targeted. Usually these are groups for things like anxiety, grief, or anger. And anxiety is the big one this year. We've actually got 2 groups, maybe even going to bridge into 3. These are done during the school day, once a week. But really, a lot of the fear and anxiety can be reduced by having open and honest communication. So we really encourage parents, for you and your students, to reach out to teachers first. A lot of the questions that you have, a lot of the anxiety that may be out there, can be alleviated by having that conversation with that teacher. And so all of our teachers are asked to respond to you within 2 school days. And if they don't, please contact us and we'll make sure that they get in touch with you as soon as possible. Our counselors provide resources, and so they connect teachers, parents, and students, and they're looking for solutions. They're looking at that puzzle and trying to solve that puzzle for you. So please use them. But again, talk to teachers first. Next slide, please. We also recognize, however, that some of our students are going through things that are much more than what a counselor can typically handle. So our district has created a form called a Request for Assistance, or RFA. And this is something that anybody can submit. It could be a student, it could be a staff member, a parent, a community member who happens to know that a student comes to a school in our district. On the district website, dsusd.us, at the very top, there's a series of scrolling banners. If you look for this image here, that's dark blue. If you click on that, it'll take you to the Child Welfare and Attendance Social Emotional Learning website. And on that website, there are more links than you can probably even imagine exist for community resources. It's quite a bit. So you may have to scroll for a while to find what you're looking for. But the most important piece on that page is located at the very top. And there's a link there that says need to talk to someone. If you click on that link, it'll take you to the Request for Assistance form. And it's just a couple of easy questions. It doesn't take very long to fill out. But what that does is it triggers a process. Our counselors meet each week on Tuesday mornings to go over the request for assistance. And it's part of a whole team. So all of our counselors are involved. Administrators are part of that. We have counselors from the district office and the student assistance program who join us, and even mental health professionals from our special education program. And what we do is we go through each one of these requests for assistance forms and look for ways and solutions that we can offer those families. A lot of times it may be additional counseling through the district that our student assistance program can provide. Sometimes it's a referral and a warm handshake to join a community resource, or something that we can't offer through our own district, but we can connect you with that resource outside of school. So please use that form if you feel that your student or a student that you know needs a little bit more than just a regular talk with a guidance counselor, school counselor. But lastly, and this is the most important, if you feel at any time that your student is in immediate danger to themselves or someone else, please call 911 or take them to the nearest emergency room. That's the quickest way to get in touch with any kind of emergency situation, emergency help. And lastly, if you have a student that has an IEP, they're part of our special education program, please utilize the case carriers. The case carriers work in conjunction with our counselors, and they often also make that communication between counselors, parents, and teachers. However, before you request that IEP, please communicate with the teachers, because again, a lot of the questions can be answered or solved, or situations can be solved by having that communication first. However, you're always welcome to request that IEP, and we'll schedule that as soon as possible. But what our case carriers do is they have a long-term history with your student. They know what testing has happened, they know what services that have happened, and they gather data. And that data is what we use at those IEP team meetings to really determine what kind of resources and supports that we can give, because nothing is done without your consent. Everything is a team decision. It's all based on data. But please know that we are all here to help you at any time. We are available through phone and email. At this time, we're really encouraging parents not to come on campus because we're trying to limit our exposure to what's out there. But if you absolutely need to come to campus, just give us a call and we can make an appointment and have you come up and talk to us. Because again, your safety of you, your family, and your students is our utmost concern.
Thank you so much, Mr. Well, and thank you, families. Thank you, Dr. Kokoski, for all the information. And parents, thank you so much for submitting all of your questions. We look forward to our next Knights Parent University. We may have a guest speaker at our next one. I'm working with our Deputy District Attorney through Riverside County offices, and we're looking at probably doing something on digital safety, just to kind of give you a precursor to what that may include. May include topics like all these TikTok challenges that we're hearing about, that we're seeing in the news, and certainly that's relevant, and we wanted to make sure that you understand and you know what you can do to help us to mitigate some of those challenges, and certainly what Riverside County is doing about it as well. So with that, parents, we want to thank you once again. I thank you for your time. Always remember that we're here for you, and certainly do visit our website for more information at www.shadowhillshs.com. We look forward to hearing from you as always. Thank you, and always remember that Knights do it right. Thanks, everybody.